Welcome to another edition of For the Health of It, a new segment dedicated to getting important health information out to you and to our community. We're so glad that you joined us for this particular segment. Today, we're dealing with Black men's health, a very important topic that is so relevant to so many of us and within our community. And so I'm excited to have this conversation. We have joining us today Dr. Pierre Etienne. Dr. Pierre Etienne is an MD with a specialization in internal medicine. And so, Dr. Pierre, we are glad to have you with us today.
Thank you so much, Pastor. Happy to be here.
All right, wonderful. So Dr. Etienne, talk to us. Why is talking about men's health important?
So I think talking about men's health and even in a further sense, Black men's health is important because honestly, we neglect ourselves. We neglect that aspect of our lives. We focus so much on providing. We focus so much on other aspects that are really important. But the thing about our health is that it is interconnected with everything that we do. It's interconnected with every aspect of our life, our spiritual life, our relational life, everything. So that's really important. But even more so, there are significant disparities when it comes to Black men and men in general as far as health. For example, Black men are 4 times more likely to commit suicide than Black women. And that's above the rate for a comparable other demographic. We get cancer at earlier stages. We don't get enough healthcare screening, and therefore that cancer, when it's discovered, is at later stages. And what that means is that we're leaving a lot of good opportunities out there. We're leaving those by the wayside to be able to improve our health and to improve our ability to survive and be healthy and thrive, not just survive, but thrive in our communities and make a difference and make an impact where it's needed. And we so sorely need that in all of our Black communities.
Definitely. So what are some important things then that Black men specifically need to know about their health that is unique to them?
So one common thing that I see with some patients is that, women have all the health issues. Women need all the health stuff. They have all the, whether it's pregnancy or women's issues or whatever it might be. But there are some very specific things that men have to remember to focus on, even up into the early years in your teenage years and going on in adulthood. And often what happens is it's better to actually be aware of that ahead of time. Think about it ahead of time and then continue on to practice and that vigilance. So one of which is testicular cancer. And that's something that can happen as early as in your 20s. And it's actually taken out people when they are in their younger years. And it's an unfortunate diagnosis, but it's very, again, the sad thing is there are certain things that are easy to deal with. So doing a testicular exam is extremely important. And it's not something that we talk about that much, but that's an important key aspect. Prostate cancer, of course, is one of those things, but specifically for Black men. And when I say Black, by the way, I say all of the diaspora, right? If you come from the 54 countries in the continent, the 13 or 12 countries in the Caribbean, South Central America, or the United States, this is really important for you. The USPSTF, which is a task force that specializes in preventative care, has new guidelines about several different things, including prostate cancer, where if you are and some of the data is a little still inconclusive, or at least data that we kind of hesitate on how we try to apply it. So it's really important to apply this with your care provider, because there are some risks to certain tests also. But prostate cancer can affect Black men at an earlier age 45, as opposed to 50 is where we're typically concerned with the average population. So that's something that, of course, it's an uncomfortable thing to kind of think about as far as getting an examination for that. But really, it's more so having a conversation with your doctor so that they can help you monitor symptoms. A lot of the testing that we're afraid of, the rectal exam and even doing PSAs, we kind of lean against doing that until you start seeing symptoms. But you need to pay attention at an earlier age. Another thing that tends to happen sometimes is, instead of a prostate cancer, and mind you, the prostate, just so that we know what we're speaking of, is a gland that actually sits right below the bladder for men that helps secrete several types of fluid into the seminal fluid that allows us to produce semen. So some people may not develop prostate cancer, but you may develop enlarging of the prostate that causes difficulty with urination. We call that BPH, or benign prostatic hyperplasia. That's something that we also, need to pay attention to. And if you start having those symptoms, speak to your primary care physician or your urologist, and they could help you through that. The last thing I will say is infertility. Okay. And a lot of times we don't think about this, but men are actually responsible for 1/3 of situations of infertility. And women are responsible for another third. And then there's a kind of a combination factor in between. So we used to kind of think that, most infertility issues were related to women's reproductive issues, but we've come to find over time and through studies, newer studies, that that men actually can have, and it's actually rising, unfortunately, infertility issues. So that's something to also keep in mind.
So Dr. Etienne, when we talk prostate cancer and these other issues that you mentioned, preventive care, early detection is like super important. But here's the issue, and just talk to our audience out there. Like men, and black men, we don't like to go to the doctor. We don't do it. We rarely do it. It's like I literally was in the gym today talking to a guy, and when he finally did go to the doctor was like, "It's been broken. Why didn't you come?" And it's just like when the pain got absolutely excruciating, and that's how it is for so many of us, and that is like so dangerous. Can you talk to us about that?
Certainly. So, there's this socialization, and it's not just for black men, but it certainly hurts us more because we already have enough barriers. But there's this socialization that men need to be tough. Men need to withstand pain. Men need to be the rock. I need to be strong for my family. But that backfires when, just like what you said, what happens is you find out that something's going on and something finally catches your attention and it's broken, right? Just like we have a car, we make sure that we maintain our car because we know if we don't, eventually it will break down. And when it does break down, it could break down in a way that's not easy to repair or is not repairable at all. And in the same sense, we need to maintain our health in that aspect. And we have to realize we need to not get in our own way. I see so many times patients come in the hospital, and the reason why they came, I'll ask them, "Hey, so what brings you into the hospital?" "My wife made me come." But this guy is actually suffering from a heart attack.
That's right.
He's suffering from a heart attack, and he had to have someone actually bring them or tell them to come to the hospital. So, fellas, we can do so much more. We can have healthier lives, longer lives, more productive lives, lives where we can care for our loved ones, our families, and our communities. And we kind of let go of that idea that we don't need to check on that we don't want anybody touching, poking, and prodding. That's not what it's about. Sometimes it's just a conversation of checking and making sure that things aren't happening that can actually help us discover as physicians if there's something else that we need to do to help you.
Well said.
And it's a lot worse on the other side if we don't.
Well said. Thank you, Dr. Etienne, for that. So, man, you heard what the doctor said. Go see the doctor. Go see the doctor. And women, do your part, and you do it. Mothers, sisters, wives, friends. Just make sure to encourage the men in your lives to go get checked out. It's something that we just have to do. Dr. Pierre, one final question. Are there any additional suggestions for how we can improve men's health?
Certainly. And, we may have to come back to this and do another segment because there are chronic conditions and lifestyle conditions that we deal with in terms of different other types of cancer, cardiovascular issues, and mental health issues. But I want to specifically touch on one particular issue or two particular issues. One is loneliness and the second is legacy.
Okay.
When it comes to loneliness, we don't realize how everything is interconnected, right?
Yeah.
Our mind, our heart, our body, they're interconnected. Our relationships, they affect us. Our environment, it affects us. And one thing that significantly affects a lot of men that we don't talk about, partly because of the actual issue itself, is loneliness and secondarily detachment from each other. When we're in positive community, when you have accountability, when you have somebody checking on you, when you're checking on somebody else, we tend to do better. We tend to thrive. We tend to be much more healthy. And so I don't want anyone to underestimate the power and the impact of loneliness in our communities. So one thing to make sure is try to get in community. It may feel uncomfortable, and that's not something that we are encouraged to do. We naturally do, and life is so busy. but try to work with and continue to get in community. Metro is an example of an amazing men's community.
Mm-hmm.
There are other communities. Whatever community works for you, get around other men, get around other people, and continue on purpose to engage and interact with them.
That's right.
The second thing is legacy. And if you remember, there's quite a few people. Celebrities are the easiest to kind of call to attention. So whether it's DMX, who died without leaving, a will, or Chadwick Boseman, the same situation, died young, my age.
Right. We go down the list. We could look at Prince. We could look at Michael Jackson. You're talking 50 and younger.
Yep. You can die, and the life expectancy for Black men is the worst. I think Native Americans may have a slightly lower life expectancy as far as Native American males, but it's about age 71 versus 77, 78, 79 for the average population and for Black women. Okay. But and even then, so there's a good number of us that still pass away earlier on. Right. But we have to be aware of leaving an appropriate legacy for those that come after us. If we're so concerned about working hard, slaving away to the point that we neglect our health, but then if something happens to us because we were slaving away so hard and neglecting our health, that we don't leave an appropriate legacy, we don't have a will in place. And I know we did a segment, Metro did a segment on all of those things. So check that out on YouTube. But make sure that your affairs are in order. Make sure you talk to your family about your history, your medical history. Talk to them about what's going on with you, what to do in the case of an emergency, all of that. That's extremely important. Awesome. In taking care of us and taking care of our loved ones in our community. Awesome.
Legacy and community. So much, just solid information. We're going to pick up, Dr. Etienne, we're going to pick up and do some follow-up on what you said, because this information is just so important that I think we do need to break this up in a couple segments so that more of us can get this info that we need. I want to thank you, Dr. Etienne, for joining us today, for being our guest today. That's our topic, Black men's health. And those of you that watch, thank you for watching and checking in with us. Want to encourage you, if this was a blessing to you and it would be a blessing to someone else, please like, please share, please subscribe to our YouTube page so that we can get this very important information out. We are our brother's keeper. We're our sister's keeper. And just simply by sharing, you will be able to provide critical information that can be a blessing to someone else. So we want to thank you for joining us for another segment of For the Health of It, brought to us by our Metropolitan Health Ministries Department. May God bless you. May he continue to keep you. And I want you to remember that God wants you to prosper and be in health. God bless you, everybody. Until next time.